Good evening and welcome to our 2020 World Voice Day event. We're hosting a webinar titled Maximize Vocal Performance and Minimize Vocal Injury. We're very excited to be presenting and answering some questions for you today. And before we get started with our program, I want to spend a little bit of time introducing who we are. And I'll start with myself. My name is Barry Hoffman-Ruddy. I am Associate Dean for Clinical Affairs at the University of Central Florida and Director of the Center for Voice Care and Swallowing Disorders at the Ear, Nose, Throat, and Plastic Surgery Associates.
Hi, and I'm Dr. Jeffrey Lehman. I'm a laryngologist, and I'm with the Ear, Nose, Throat, and Plastic Surgery Associates. I'm the Medical Director of the Center for Voice Care and Swallowing Disorders.
Hello, I'm Dr. Brian Spector, and I am a general ear, nose, and throat physician with the Ear, Nose, Throat, and Plastic Surgery Associates with an emphasis on laryngology as well.
Dr. Rodney?
Hi, my name is Jennifer Rodney, and I'm a laryngologist as well with the Ear, Nose, Throat, and Plastic Surgery Associates.
I'm Emily Dunn. I'm one of the speech pathologists with Ear, Nose, Throat, and Plastic Surgery Associates.
My name is Beth Lanza. I'm also one of the speech pathologists on the voice care team.
Hi, I'm Austin Collum. I'm also one of the speech pathologists who specializes in voice and singing voice disorders.
So this year, our focus on voice and our World Voice Day program is to promote vocal health and prevention in our community. And it's a very unique time where we are celebrating the human voice because it is one that unites us and comforts us, particularly during a period of time when the bulk of our communication is done between telephone and FaceTime and Zoom calls and a variety of other technology means. So the goal of our webinar tonight is to spend a little bit of time just first talking about signs and symptoms and how to recognize some of the common signs of early voice difficulty, voice and upper airway disorders, and share some information about how we evaluate voice and upper airway disorders. What are the tools that we use to image the vocal folds? How do we characterize what we hear objectively as well as subjectively? And spend the bulk of our time answering your questions. And we received a good number of questions from those of you who are participating. We hope to be able to answer all of those, plus anything that you'd like to ask us during the course of our session here by using the chat tool. And so we will be monitoring that. Dr. Rodney will be calling out some questions as they come up. Please feel free to use that at your convenience. Before we begin, I want to talk a little bit about the evaluation and treatment, or more so the team members in voice care. And this is very much a team sport. The primary members of the voice care team are the otolaryngologist or the ear, nose, and throat physician, and those who specialize in laryngology problems or voice-related difficulty and laryngeal function disorders are often referred to as laryngologists. And we're very fortunate to have three specially trained laryngologists who are part of our team and participating tonight. A speech pathologist who specializes in voice, oftentimes referred to as a voice pathologist or vocalogist, are the two members who evaluate the history and the timeline, the current symptoms, image the vocal fold, listen and characterize what they're hearing, identify other health-related difficulties that may be contributing to the voice problem, look at occupational load and a variety of other factors. Oftentimes there are other health-related problems that we need to address, and so our team actually expands, and it could be to gastroenterology, particularly when reflux-related disorders can influence the upper airway system, endocrinology and pulmonology, particularly when there's lower airway disease and lower airway symptoms that may be having an upper airway effect, neurology, allergy, and many others. So getting into the evaluation, I'm going to have Dr. Lehman take over this next part.
All right, so a little bit of this has changed post COVID-19. You know, in the past, you know, you would call up, ask for an appointment, we'd bring you in, and we would do a lot of the history, general physical evaluation, and have the voice pathologist involved in assessing voice, and oftentimes would do video stroboscopy, which we'll get to shortly, as part of that initial evaluation. Things are quite different now, and to minimize risk of virus transmission and to attempt to streamline the process and make this safer for everybody involved, frequently now what we will do is do an initial intake examination and history by telemedicine. And at that time, determine if indeed the next appropriate portion of the evaluation will be some sort of imaging of the vocal folds. Get that set up along with some scheduled interaction with the speech and voice pathologist, and also very importantly, get set up for COVID-19 testing to be done before the examination to ensure the safety of all involved. So I'll go through these slides though, kind of highlighting the examination as we had previously structured it, keeping in mind that, you know, the ground rules are changed in our new normal. So physical exam is to look at, you know, all aspects of the head and neck examination, see what can potentially impact voice. It's not all vocal folds. The vocal tract is a significant portion of voice formation, and sinus and allergy issues can certainly affect how the voice comes out. Listening to the voice and breathing has a lot of bearing. And many times, those of us who have been doing this for a while can get a pretty good idea of what's going on with the vocal folds just by getting that initial listen to the voice. We also want to, you know, check the neck for muscle tension, masses, swelling, and then imaging the vocal folds obviously is crucially important. Indirect mirror is kind of an old way of doing it. We still do it occasionally, but generally go right to either a flexible fiber optic examination with plain video, or using the video stroboscopic system, which gives us a good image of the vocal fold, an idea of tissue quality based on what we see with vibratory function during voice production that can be seen very well on this examination. And then direct laryngoscopy, that's in the operating room, and typically that is coupled with surgical intervention if necessary. So let's go on to the next slide. So oftentimes laryngeal function studies are used as well. These assess both the acoustic qualities and document acoustic qualities of the voice, aerodynamic functions such as airflow and pressure. And EMG, electromyography, is something that can be used in certain situations when it is helpful, measures the actual electrical activity in the muscles that are tested. These are some scales that are oftentimes used, and these are really pretty much a standard part of our voice pathologists evaluation, voice handicap index, and some of these others that are listed on this slide in order to get an idea and a documentation of symptom level. So the examination, a flexible fiber optic nasopharyngoscopy and transnasal endoscopy is a good comprehensive evaluation of the vocal tract. We get a good look at the nasal passages. We can get a look at the palate to assess velopharyngeal function. We get a very good look at laryngeal motion and function during all sorts of vocal tasks, speech and non-speech. It's a very helpful evaluation for swallow. One of our swallowing methodologies for evaluation is a functional endoscopic evaluation of swallowing, where we put actually dyed material of various consistencies, have the patient swallow that, and we can observe you know, how that ends up during the swallow with the flexible evaluation. And then also we can see what's happening during singing activities, and that's something that's frequently used with vocalists. Certain flexible laryngoscopes will have a working channel that can be used to pass small flexible instruments through for various office procedures. So the video stroboscopy can be done in a couple of ways. There's a rigid laryngoscope, which we'll talk about here. This looks down at 70 degrees most typically. It's placed in through the mouth to the back of the mouth, about as far back as your toothbrush would go. And that downward angle allows us to visualize the larynx quite well. The advantage of this is we have a good magnification and really good optical quality, and the back of the throat can be anesthetized to help with the gag reflex, which can be, sometimes a troublesome part of this evaluation. So this is a view of what we would see normally during an endoscopic evaluation. You can see the vocal folds coming together. You can see that undulating motion, which we refer to as mucosal wave. It's a traveling wave over the surface of the vocal fold during the vocal cycle. And you can see when you look at that, you can get a really good idea of the characteristics of the tissues there. When things are nice and symmetric and you see a good progression of this wave edge, we know that the vocal tissues are thin and pliable, and there hasn't been a significant amount of scarring or inflammation or damage. Also, you can pick up real subtle things, subtle small nodular prominences, polyps that are on the lower or subglottic surface of the vocal folds as you kind of see this surface roll through during the vibratory cycle. All right. Well, I think we have some questions coming up as our next component of this webinar, so I'll turn it back to Dr. Ruddy.
Okay. So don't forget the chat button is open and available for you to write in any of your questions. The first question I'm going to ask came from an audience member who wrote into us. And Dr. Rodney, I was hopeful that you might answer this one for us. The question is, how do you decide if someone needs surgery on their vocal cords?
I'll take this question. So how do you decide if someone needs surgery on their vocal cords? That is something that we have trained for years to answer. Unfortunately, it is not a black and white answer. I wish it were. I think we all wish that it were, because then it would make our visits quite quick and easy. But a lot of things are in the gray area. And I think that this really gets to the art of medicine. Medicine is an art, and a lot of physicians will have different levels of experience and training and kind of reasoning behind the decisions that they make. But there are some very straightforward cases that we all agree upon as far as management. And, I think we all can agree that for the most part, we try not to do surgery as laryngologists. If there is an issue that a patient has that, if at all, can be treated with conservative management, then we would love to do that for the patient, because that is the lowest risk. So if that is an option for them, we love to go down that route first and exhaust all non-surgical options. And that is why we work with our speech pathologists hand in hand in managing patients, because that is their arena, is getting patients better without needing surgery. But if they have tried non-surgical therapy, whether it's medical therapy or voice therapy, and that has not gotten them to where they need to be, then that's when we talk about surgery, because sometimes that is the only option. There are certain types of pathologies that we know through experience does not do well without surgical therapy. So sometimes we do have to go towards the surgical route right off the bat, because we know that trying other things have not been successful in the past. So it really depends on the type of pathology that the patient has. It really varies from patient to patient. But I would say the main goal is to try to stay away from surgery if we can.
Dr. Rodney, as a follow-up to that, because we know in the clinic so many patients ask this question, what does the path look like for a singer who's had surgery in the post-op phase? What types of other therapies or other interventions are needed, and what does a timeline look like for getting back into their vocal performance?
Well, I would say that most, if not all, patients need to engage in voice therapy after having surgery. You know, voice therapy, especially for me, and I think most of us would agree with this, is an integral part of almost every pathology. You know, if you're going to be operating on the vocal folds, you're changing the anatomy of the vocal folds, and it takes some getting used to and to work through that and to get back to a new normal, to use that phrase that we've used before. You know, it often takes working with a voice therapist to guide you back in a healthy direction. Because sometimes, you know, depending on the pathology, you do have different anatomy than you did before you started the whole disease process. So you know, I always use the analogy of a sports player that hurts their leg and needs physical therapy after a surgery. You know, you can't do an ACL repair and just send the person back to playing professional football. They have to do physical therapy to rehab themselves. And it's really very similar in the voice world as well. So that is almost always an integral part of the post-operative phase. And, you know, as far as getting back to singing at, you know, back to where you were prior to the injury, that definitely changes from patient to patient. It depends on the lesion, depends on where they are as far as their preoperative knowledge of vocal hygiene and things like that. You know, it really, really depends on the type of lesion, but it is definitely not, you have surgery and then the next day you go back to singing, you know, Broadway. There definitely is normally several weeks before we graduate you to going back to singing. And it's often a gradual process, a step-by-step process that is guided by the speech pathologist.
Thank you, that's excellent. So another question from an audience member, Dr. Lehman, would you mind answering this question? Do you recommend steroids for voice problems?
Well, steroids certainly have use in laryngology, and I guess I divide it into two different categories. The first one would be the kind of the Band-Aid category, I guess I would call it, and that's somebody who's in the midst of you know, a vocal challenge that can be demanding, and that they really have to do. You know, they have a really important gig coming up. You know, they're scheduled for studio time, and something comes up, either inflammatory acute laryngitis, or they may have a mild vocal fold injury, a little bit of swelling, and they really need something just to help them get through this important performance. And so steroids are oftentimes used in that situation with the intention of enabling this performance, kind of getting through it and then addressing what may be going on underlying it afterwards. It's important in this situation to get a look at the vocal folds, because we don't want to be enabling someone to perform if they have a dangerous situation, like an acute vocal fold hemorrhage. You know, we want to make sure that this is more mild, you know, inflammatory type interruption in vocal fold vibratory function that we can safely treat in this manner with steroids. Steroids are also used therapeutically, and will oftentimes do this in conjunction with good modified vocal rest. And that's the key thing there. When we're using it therapeutically, we really want to have the vocal folds in a good state of rest to allow reduction in swelling, allow some of the reduction in inflammation there, perhaps soften scar tissue or fibrous tissue, and treat things like nodules and potentially small polyps with steroids in conjunction with good vocal rest. As an adjuvant therapeutic method, we oftentimes will use them for people who have an acute asthmatic flare-up or are having a bad allergic flare-up. that's really affecting their overall vocal quality. Steroids can significantly reverse the inflammation associated with asthma and allergies, and allow somebody to get to a better state where we can manage things then with some medications that are a little less high test, if you will, and get them back to good vocal performance in that way. The other way steroids are used therapeutically is that sometimes we do direct injections of steroids into the vocal folds if there is scarring or something that's a little bit more of a stubborn type of a problem that's affecting the vibratory function of the vocal folds. So carefully injected steroids into the vocal folds, which can be done in the operating room with direct microlaryngoscopy under anesthesia, or it can be done in the office under topical anesthesia with various techniques that can soften scarred areas potentially and get stiff vocal folds vibrating better. It's certainly not a first option that we turn to, but for the more difficult cases, this sort of use of steroid can be helpful. Some people do use inhaled steroids. I'm not a big fan of those for treating voice disorders. Many times the performers who have asthma do need to be on an inhaled corticosteroid to keep their asthma under control. One of the things we always watch for in those individuals is the potential of them developing fungal infections on the vocal folds. They can oftentimes happen, kind of an oral thrush, if you will, but in this case, on the vocal folds themselves, and that can result in a significant amount of hoarseness. Fortunately, is something we can usually correct pretty readily with appropriate antifungal therapy and trying to minimize the inhaled steroid use.
I also have a follow-up question by an attendee who is asking about steroid use. She's asking about people that are in groups that perform frequently, such as the Voices of Liberty. And she is saying very intelligently that people in a group like that can't use steroids every day for the purpose of being a functional performer, because, steroids every day are, not a great idea. So she's asking, what is an alternative to that?
Well, the best thing really is trying to minimize inflammation by having a very good regimen of vocal hygiene, good hydration, taking care of yourself as far as dietary factors that could increase inflammation by prompting reflux, things of that sort. There are some supplements, turmeric in particular, that can have some anti-inflammatory qualities that could be helpful. I'm not a big proponent of taking non-steroidal anti-inflammatory drugs on a regular basis to reduce inflammation of the vocal folds. They can actually sometimes have the adverse effect of making a reflux situation worse. And yeah, definitely with steroids, using them to reduce inflammation, I try to reserve them for those acute emergent type issues that may come up from time to time where a performance really needs to go on. I don't like seeing people resorting to those more often than once every couple of months. If it's getting more frequent than that, we really have to do some deep diving and find out what's going on.
Yeah, I agree. I think she brought up a very good point, that I think that is a commonly talked about issue in the laryngology community and the voice community is steroids and frequency of steroid use. And I think that is some dangerous territory that we all need to look out for as performers and as practitioners, because it often can be overused. And I think that predisposes performers to more vocal injury because you feel temporarily better and your voice sounds better. And so people may be more likely to push their voice when they shouldn't. And, it really needs to be in conjunction with a very regimented plan guided by your physician, by your speech pathologist, to reduce your vocal load while you're on steroids, not as a tool to increase your vocal load.
And I'll actually jump in here from the speech pathology perspective as well, to go along with other ideas that can be beneficial with reducing inflammation without having to always jump towards steroids. There's actually some great research about specific types of exercises that can attenuate acute vocal fold inflammation. The study was done by Kitty Verdolini Abbott. And what they looked into were just some easy exercises that most of us use as singers, resonant exercises like buzzy hums or semi-occluded ooh, straw exercises, different things like that. And they actually found that those can attenuate acute vocal fold inflammation. So really having a great warm-up routine and a cool-down routine as well that can help to sort of ward off inflammation as it occurs and even be preventative with it with your warm-up routine as well.
I'm going to ask another question that came from the attendees. Emily, would you speak a little bit on what you wish all voice teachers knew?
Yeah, I think there's a lot that we could probably have a full hour just on that. And I also saw in the questions, it was asking about when should you send your students to see a laryngologist? And I think that is really important to think about your students as being vocal athletes, and yourself, when to take a visit yourself. And just to hop on Dr. Rodney's analogy of athletes, we don't expect an athlete to make it through their full professional career without experiencing some type of injury. And it can be the same for singers. And I think there's a lot of stigma that goes along with experiencing vocal injury, wanting to maybe not acknowledge it, hope it goes away. And then we hear all the time, I guess this has been going on for a year. Now that I really think about how long I've been having some problems with my voice. So one, I think it can be really helpful for singers to have a baseline study and come in to see us when everything's going well. And then we have good imaging of what their vocal folds look like when things are going well. And then if there's any sort of sudden onset voice change, especially outside of an illness, so we hear all the time, I was singing in the car, or I was in a show and I just felt like something wasn't right and my voice changed and it wasn't the same the next day. Any loss in range that goes on, for longer than a week or so, again, outside of an injury or an illness. And it's helpful if we can see people sooner rather than later. So I think that is I always like when we have singers who come in who've been referred by their voice teacher, and not feeling like as a voice teacher, you shouldn't send your students to us, because what if we see all of your singers? Are we gonna think that, we shouldn't send someone to your studio? Those are some of my favorite voice teachers who know their students' voices and say, you know what, something's changed and you really should go have some imaging to make sure everything is going well. And that if you need some help from, again, one of us, a speech pathologist or one of our laryngologists, if something medically is going on, that we can help you sooner rather than later, because that makes our job a little bit easier and tends to get people back up and running at their normal sooner.
And Emily, I just want to chime in and just mention that we oftentimes see singers who will come in asymptomatic on a yearly basis for a vocal wellness check, and that's never a bad idea as well. Did any of our laryngologists want to comment a little bit on that question as well?
Yeah, I've been quite happy to see students sent over from voice teachers in the past. I think I'm amazed at the level of perception that's usually there. Hearing something in the voice is just not quite right, not quite the same as it was, and actually, there can be issues going on. Fortunately, they're usually subtle issues, and there's things we can address conservatively. But yeah, there have been patients that have been sent in, with polyps, with things that are, potentially requiring surgical intervention. And it was the astute observation of the voice teacher that sent them in. So, again, been a good relationship that we've had with voice teachers over the years.
I would also add that for people who come into the office, they're going to see a video of their vocal folds in action, and I think that's nice. It's sort of a biofeedback where you can see a little swelling and then correlate that with a change in voice, and that's something they can take home with them and use in the future as well.
I would also, in regards specifically to the question about, when should people be referred by their voice teacher, I think there's a lot of, there can be some fear in that. Sometimes people don't want to know if they have something going on. And I would just reassure you that the majority of the time, there isn't something bad going on. Normally, it is something that's very manageable. And, when we talk about lesions versus functional issues, that really depends on how you're using your voice, and your anatomy is relatively normal. Most of the time, it's the latter. Normally, there is not a lesion. And so, that's good information to have. But I think, as far as your odds go, normally it is something that is relatively, easy to correct, easy to work with, and get you back where you need to be. And it's not most of the time not something that is going to really alter your career.
So Austin, would you mind answering for us what specific exercises should you do to regain strength and stamina after vocal injury?
Definitely. So I definitely want to start by talking a little bit about where we usually start with our patients who have experienced some sort of vocal injury, because a lot of how we start off can really affect our stamina afterwards. So typically, whenever we see patients who have had some kind of vocal injury, we are going to put them on some form of voice rest, whether it's complete voice rest or a modified voice rest. And so one of the things is that we always have this balance for especially our performers, of how long do we keep you on voice rest? Because we don't want to affect your stamina afterwards and cause any sort of atrophy throughout. So that's one thing, is that we want to always make sure to work with you to have an appropriate amount of voice rest based upon what type of injury you have and how long this issue has been pressing for you. We also want to work with your performance schedule. We understand that sometimes complete voice rest isn't really an option for you, and so we also want to keep that lens. But that's one thing that we always want to balance, is exercise with rest as well. So then going into more specific exercises, once we have completed some form of voice rest, whether complete or modified, we typically want to look into some sort of exercise that is going to help to offload tension and offload impact stress to the vocal cords. And those are typically exercises that we refer to as semi-occluded vocal tract exercises. Those are going to be exercises, again, that are going to help offload impact stress and create back pressure within the voice box, so where we really can't add as much strain or tension into the vocal mechanism. So that's one set of exercises that we use typically. And then we also want to play around a little bit with different sort of muscle groups, essentially. So we want to make sure that we are working out different registrations. We want to have some flexibility exercises in there. So we're going to have some glides to make sure that we're working those muscles that elongate the vocal cords. And then we also want to work with some of those muscles that help to adduct the vocal cords, or keep them in the middle and help you to hold out those money notes, right? So we work a lot with sustained phonation as a way to strengthen the vocal cords as well. Of course, everybody's routine is a little bit different. We really try to specialize based upon what type of music are you singing. We're going to work on healthy belting techniques if you're in that sort of style, or we're going to work with different sort of classical techniques once we have sort of gone through more of a rehabilitation process. So There's definitely a lot more specificity that can be added there, but that's typically where our minds are going to go to start off in building you a rehabilitation routine after you've experienced vocal injury.
And I'm going to add to that also, many times building stamina and getting back into your regimen of vocal performance can involve some focus on the respiratory musculature, the respiratory system being the power source. And many times we're very focused on the larynx itself, but oftentimes need to address the coordination between the respiratory system and laryngeal function. And so we see more and more singers who are starting to engage in respiratory muscle strength training exercises as a means to combat fatigue, not necessarily to make them louder or generate more pressure, but to make the system, the respiratory system, more efficient. So physiologically, they feel like they're not working as hard to produce the same task. So that's an option that we can also offer to patients as part of a comprehensive rehabilitation program.
All right, there's another question from an attendee. She has a history of a polyp on her vocal fold and a blood vessel that's feeding into the polyp. She has had a direct microlaryngoscopy in the past, and she's a master's voice student and wants to know if there is a way to tell without being scoped that there's been any recurrence or any change in her voice, in her anatomy.
Well, being the laryngologist and the one that's looking at potentially operating on those sorts of things when they're significant enough, there's nothing that really substitutes for us for having that look at it. Video stroboscopy, seeing what it looks like, not just size, but how it affects vibratory function, see what the feeding vessel looks like if it's still there. But short of that, a polyp or a lesion, assuming there's a polyp there, you can oftentimes appreciate changes in the voice that would occur as it would potentially get larger or potentially firmer. The danger with doing self-assessment there is because you live with your voice every day, sometimes, unless you're very attuned to it, it may be difficult for you to perceive the subtle changes that occur over a period of time. When somebody comes in to see us at one point in the visit and we get the video stroboscopy, we assess the voice, we have the recording to listen to, and then we see them a couple of months down the road, oftentimes that segmented assessment over a period of time, we can really appreciate the changes that may not be so apparent as you live with it day to day. Just one other thing I'd like to add about the feeding vessel situation is that is something that can be a concern regarding potential for hemorrhage depending on the size of the vessel. And that's something that can very safely be treated if it is a potential danger issue with CO2 laser. Just little micro spot bursts with that can coagulate a vessel of that sort with minimal damage to surrounding tissues if done carefully and expertly.
The attendee also asked, is it possible to just mask symptoms by proper singing technique?
Yes, it is. So our best trained singers can sing around some pretty prominent looking polyps or nodules or little blips along the edges of the vocal fold. It amazes us sometimes how good a well-trained voice can sound in the presence of something like that. And the video stroboscopy can sometimes look pretty amazing that, how can you even be doing this? But yeah, a trained singer can do amazing things to compensate for lesions on the vocal folds.
Right. I would say that, nothing replaces stroboscopy and actually looking at the vocal folds. So, you're kind of guessing by going just by symptoms. But, you know, there are some hints as to what may be going on, you know, such as increased strain, decreased range. You know, especially since this attendee has had this issue in the past, she knows what it felt like when it happened. So if you feel those same issues, pain, strain, fatigue that you had when that did happen, and you did have video stroboscopic evidence of something going on, then that could be a tip-off that maybe something is happening again. You know, and I would just mention as well, you know, it's a blessing and a curse, because if you do have really great singing technique, you can kind of maneuver around some pretty significant issues. But that doesn't mean that you should do that, because that can almost be more hazardous to you, because you can kind of work around it, and that's not necessarily a good thing. You know, just because you can get through 8 shows a week and sound okay doesn't mean that you necessarily should. So don't let that keep you away from the doctor's office.
Oh, go ahead, Beth.
Sure. I was just going to say, I think that's a really good plug as well, to encourage especially high-level performers to have an established relationship with a voice care team. I know, you know, not to plug just for our office, but I know that a lot of voice care centers, they will really prioritize their performers. And so you know your voice very, very well. And we all know as singers that, you know, we have good days, bad days, and that doesn't necessarily mean a pathology. But we start to kind of gauge that balance of when we want to know for sure. It's good if you've had that baseline, and then reaching out to check in with your doctor, your speech pathologist, and even say, you know, what do you think? Do you think it's time that I should come in?
And I also want to say, you know your voice better than anyone does. And living in fear of if this is going to come back isn't going to serve you and your voice. So trust your voice, and it sounds like you're going to be smart about it. So if there are changes, go in and see someone. But that doesn't mean you need to constantly live in fear of this coming back. And sometimes our hesitation about, am I singing properly, can sometimes lead to other poor technique issues where we feel like we're holding back. So again, just what everyone else said, be established with someone, know your voice, and keep taking care of it.
Okay, I think we lost Emily a little bit there. I'm going to move on to the next question. And Beth, I can't think of anybody better to start off answering this, given your long history and performances and long runs of performances. Can you shed light on how you can prevent fatigue during a long performance run?
Sure. So this is another one that I feel like we could talk about for a long time. And I think one of our favorite terms in our voice care team is the term vocal athlete, because truly the things that we need our voices to do as performers is remarkable. And just to kind of remind you, and we all know that this tiny instrument that we have right here, it's the only one that we have, right? So if we need that for a demanding performance schedule, whether that's 8 shows a week, or in Orlando, hopefully very soon, 8 shows a day, we have to think about the whole picture. So thinking right off the bat, let's say you get cast in a show, and I think the best thing that you can do as a performer is your research right off the bat. Get your hands on the score, get your hands on the script, and see immediately, even before the rehearsal process begins, what kind of demand this is going to be. We are learning a lot about the voice through a lot of exercise research. Surprisingly, not too many singers want to let needles and, you know, examinations of muscle samples come right from our vocal folds. So we learn a lot from the exercise science, and it takes time to build muscle. And it takes time to build the way that our brain responds to new exercise tasks, and the way that we can metabolize energy as we're learning these new exercises. So if you can get an idea right off the bat of what a show is going to demand of you, then we need to start thinking comprehensively, what is your body, what is your voice going to need? And thinking about longevity, right? Hopefully this is only, you know, one of many gigs that you're going to have. So thinking about how are you going to pace yourself? So physically, can you be exercising? Are you getting enough sleep? Do you have good nutrition? We talk so much about hydration, thinking about how important it is to intrinsically keep our entire system well hydrated, and especially for our voice, how effective that is. And then the stamina too, when it comes to building up your voice. So thinking about what are the demands? Am I singing in the show? Am I screaming in the show? And starting to break it down and work with your trusted, established team. Work with your voice teacher. If you have a voice pathologist and you know that you had an injury in the past, bring your script to them and say, okay, what strategies do I have that I can start working on these things? And I would encourage you to start working in really small, frequent chunks right off the bat as you start building into this script or into this new score. Once you're in the rehearsal process, this is your opportunity to kind of figure out what is it doing to your whole system. And this is when you figure out how you need to pace yourself. And this might even go back a bit to Kelly's question before about Voices of Liberty, thinking about, okay, what do I need to get through? Are there opportunities where I can pull back, where maybe I'm in an ensemble scene? Do I really need to be talking as loudly as possible during this time, or can I show or demonstrate energy in another way that's not vocally related? When you're off stage, do you need to be talking to your castmates? Can you be having some modified vocal rest? Do you keep straws at your station or backstage or in your costume pocket so that as soon as you're off stage or you have a moment, if it's helpful for you to kind of check in and re-coordinate with your breath or your resonance, is that going to be a helpful tool? Do you have a steamer at your station for intermission if that's something that you feel like is beneficial to you? And the other thing that I would encourage you to think about is thinking about your vocal budget. I'm not sure if someone said this earlier or not, but again, it's one instrument. So thinking about what your voice can do as if it were a certain allotment of money. If you only had $10 to spend during the day and you're about to go play Elphaba at night, you know, that's a huge demanding belting role, right? Let's say that's 7 of your $10 of your vocal budget. I'm simplifying it a bit, but then you only have $3 left. So look at the rest of your day. Are you one of the many performers who has a day job? Are you waiting tables? Are you nannying? Are you teaching? And thinking about how else you use your voice during the day and seeing if there's any ways where you can pare back to give yourself more stamina in the meantime. Of course, always having a good warm-up routine and cool down routine. At the end of the show, we all like to go and blow off steam with our castmates, but you're going to figure out pretty quickly what you need to get you through that next show or the next day, and making those adjustments as necessary.
That's excellent. I think we could probably host a whole webinar just on that topic. Thank you. Dr. Spector, you talked to us a little bit about sinus infections, and the question is, can sinus infections damage your vocal folds? And can you stop sinus infections when they first start?
I like to tell my patients that voice is a combination of this wind instrument meets a string instrument. So anything that affects airflow can affect your voice. Anything that affects the vibration of those strings or vocal folds can affect your voice. So you can imagine a direct effect from things like postnasal drip, stuff that's coming down and directly irritating the throat. But also the response to that is going to be you're going to want to clear your throat, or you're going to want to cough. When you do that, those vocal cords, boom, 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 will come together, and that creates some swelling, which can affect the vibratory quality of the vocal folds. Also, sometimes you might take medications like antihistamines that will dry you out. And as we've touched on a little bit, it's got to be a well-oiled machine, and the oil is water. So you need to be well hydrated. So some of the medications you take because of the sinus infection can be a problem as well. And if you're breathing through congested airways, and if it's triggering asthma, all of those things can have downstream effects on the vocal quality. So what do you do? It depends. If you're in the midst of an infection or you're in the midst of an allergy, that's one thing. But before we get to that point, I would say that in general, kind of know your sinus condition, particularly if you're a vocal performer, so that you can be proactive, that you can get on a maintenance strategy. For allergy, for example, often the dust mites are like microscopic spiders that live in the dust. So wash your nose and kill them with hot water, or hard surface flooring is better, and so on. You can do that with pets, keeping them out of the bedroom, although it's always very difficult to keep the pets out of the bedroom, and so on. Now, when it comes to medical management, you might do things that control that postnasal drip so that you're not as prone to throat clearing and the coughing. Also things that open up your airways. So nasal steroid sprays would be an example of that. Some well-known ones would be Flonase, Nasonex. Some of these have gone over the counter. So if that's you, or if it's you during certain times of the year, that's a good thing to do to be proactive. And all of us really, I think, would endorse saline nasal spray also. Even if you're getting a cold coming on, it kind of is a little tsunami that'll wash away those little viral particles and help the mucus to clear out better. Get plenty of sleep, and watch your voice use in particular, like Beth was just saying, so that you probably go from $10 of voice use to $3 when you have a sinus infection. The other thing in the category of allergy would be something like immunotherapy. So if you really know you suffer, and this is really impacting your voice professional, whether that be a singer, a teacher, a coach, and it's really impacting your ability to communicate, then immunotherapy is a wonderful option where you can get desensitized to the things you're allergic to. Concept is a bit like if you have honey from local bees, you might get desensitized to local pollens. For whatever reason, when our body ingests allergens, things that trigger our allergies, either through drops into the tongue or injections into the skin, our immune system shifts and we don't get so overactive in response. So for a true sinus infection, that's where you have to make that call with an antibiotic. Of course, antibiotics can be overused, so most of our upper respiratory infections are viral, and you just kind of ride them out, except for the current virus. And then the antibiotics come if you're clearly seeing something. We might hedge a little bit in somebody who's got a big performance coming up and they're showing signs and they know themselves well, and we know them from prior evaluation. And so my last point I would make is we may or may not cover this, but we do see a lot of sinus and allergy problems, and our vocal performers do really well if we treat that adequately. But reflux would be another big irritant to the airways that can also trigger the throat clearing, the coughing, that creates swelling, and the viability of the vocal folds or vibratory characteristics change. And so that can cause problems with voice. Next thing you know, they're bringing in extra muscles to add strain to your vocal quality. So it's all a big continuum. So it's often an indirect effect, but it's an important one.
That's excellent. Well, we've got about 3 minutes left, and we've got one question. I think it's an important question. Dr. Rodney, can you shed some light on how you reduce the risk of vocal polyps, vocal nodules, or any type of tissue change on the vocal folds, benign tissue changes?
Sure. So, I think this is what a lot of professional voice users and voice users of any type worry about. That's, in movies and in the media, that's what you hear about, polyps and nodules, and it's the scariest thing to a lot of people. Occasionally it does happen. And how do you reduce the risk? I mean, I think a lot of the things that we've said so far have played into that answer. It's all about vocal hygiene. It's all about, I love the phrase that Beth used with vocal budget. You want to conserve your voice as much as you can within reason. That is difficult to do if you have a very vocally demanding job. And as Emily said, sometimes it is inevitable that if you have a very vocally demanding job, sometimes these things just happen. It's not your fault. It's just a hazard of the job. It happens to many people. So, things that you can do within the constraints of your profession can be a lot of the things that we said. You want to try to avoid vocal strain and fatigue by not pushing yourself out of your range. If you know that you're an alto, don't try to sing soprano. A lot of people, you know, especially if they do voiceovers, will be asked to speak in a different way or sing in a different range that isn't their natural range. And, you know, you kind of have to think long-term instead of short-term. Of course, you know, sometimes it is a paying job and that's how you pay your bills. But if in the long term, it's going to cause you to have extreme vocal strain, then it may not be worth it, because using your voice in a way that it's not meant to be used can lead to vocal trauma, which could lead to a polyp, for example. So, you know, I would say that is the main thing, is try to, you know, just keep a very close eye on how you feel, you know, check in with yourself as you're performing and try to modify if at all possible. Just like I think Beth was saying earlier, you know, if you're performing, whenever you can mark instead of singing full out, you should, you know, try to just, you know, try to sing in your head voice instead of belting. You know, if you're just in a rehearsal, you don't have to belt like in a full out performance, to save yourself for the times when you do have to do that. So it's all the little things that add up to hopefully keeping your voice in good shape, so that way you can have a long career. You know, other things, I think the general topic of inflammation can play into that as well, just like Dr. Spector was talking about, you know, maintaining your reflux, allergies, keeping all that in mind. That's important, because reflux and allergies can lead to vocal fold inflammation, which, although it probably doesn't play a predominant role, you know, everything is all related. The entire upper airway is related. If you have a lot of inflammation, that can cause, let's say, postnasal drip from allergies, that could cause you to have throat clearing. Throat clearing, you know, potentially, theoretically, could lead to vocal trauma, and the end result being vocal polyps. Not to be too dramatic, but, you know, if I'm trying to really oversimplify it, all of these things, if done for very long periods of time, you know, possibly could result in something like that. So just try as best as you can just to keep your body as healthy as possible, and try to conserve your voice as much as possible within the constraints of your job.
And with the 1 minute we have left, the most timely question: is there anything that we can do as performers during this time of sheltering at home? Are there any recommendations for performers? Emily, any pearls of wisdom there?
Well, certainly if you weren't feeling like you needed some vocal rest, try to keep up with your regimen of singing right now. Try to keep yourself going. We've talked a lot about stamina and fatigue. So try to keep up with some daily singing, or at least have some sort of schedule and structure throughout your week, doing some warm-ups, some voice exercises. It's really easy when we're out of our regular schedule to get out of drinking our regular amount of water. So staying well hydrated throughout your day. And yeah, just keeping to do things that you enjoy when you know you're going to be heading back to, especially for our performers, when you know you're going to be getting close to heading back to doing some performances, start building up to your regular repertoire that you're going to be doing, and trying to get yourself at least somewhat close to what you're going to be demanding of your voice when you get back to your regular schedule. Anybody else?
That was excellent. And we are at our time, and we want to thank everybody who participated. These were very thoughtful questions. I speak on behalf of the panel. We enjoyed answering them and hope to be able to do this again, answer additional questions. Any parting words from the panelists?
No, thank you everyone for attending. It's great to be able to interact in whatever manner we can. And yeah, this is our way of being able to connect with you. At this point in time, we hope to be able to see you in person at a date in the near future.